Hi, this is Dr. Bunkis, Orange County Plastic Surgery in beautiful Corona Del Mar, Newport Beach, California. Today we're putting in some calf implants. We put in calf implants, pectoral implants, buttocks implants, probably more than any other practice around here, but when you look at it in the whole scope of the picture, these implants are far less common than something like breast implants. In our practice, Dr. Deborah Ekstrom puts in most of the breast implants. I put in most of the calf and pec implants and the buttocks implants because it requires a certain degree of strength to get them in. But if you look at this gentleman that we're doing today, he has very, very, very thin calves. The procedures you will see in a few minutes entails making incision in the crease behind the knee, dissecting a pocket over the medial head of the gastroc muscle and over the lateral head of the gastroc, and enhancing these areas. He has very thin thighs, he has very thin ankles. Those will not be affected, but by just enhancing his medial and lateral heads of the gastroc, it will give him a more masculine looking leg. Let's go to the operating room and I'll show you how it's done. We're in the operating room now, and as we do with all of our cases, we inject local anesthesia first. The local anesthetic has a medication in it called epinephrine, which causes blood vessels to constrict. It also has a solution called TXA in it, and that also causes less bleeding during the case. And you'll see when we do this, there's very, very little bleeding. And we're injecting right where the incision is, where my tract is going to be, and where the two implants are going to sit. As you can see him in person, he's got a very, very thin calf. And just as in breast implants, the smaller your breast, the smaller an implant I can put in. Same thing with calves. You know, you'd like to give this guy big calves because he doesn't have any, but if you have very small calves to begin with, all I can do is put in the very smallest implant, and proportionally it'll give him a very sizable improvement. We have to keep it kind of balanced with the appearance of the rest of his leg and his ankle and so forth. So once this local is in, we'll let it sit for a couple of minutes, and then we'll make that incision behind the knee and make some pockets down here where the implants are going to go. This is what the implants look like. They're made by a company called Implant Tech. They are a soft, solid implant. They bend very easily, but they don't have a liquid center the way a breast implant does, and for this reason they never wear out. You can put this in, keep it in there for 50 years. It's not going to matter. Each implant has a different lot number, different serial numbers, so we keep track of where we're putting each individual implant in. And we usually use a slightly different implant on the medial and lateral sides of the leg. One side's a little bit bigger, but in him we're using the smallest implant for all four implants because he just has such small calves, and I just don't think anything bigger will fit. We'll let this soak for a bit, and let's go ahead and put the first one in. Okay, this is the first implant going in, and it's a bit of a struggle to get it in because I have a very narrow tunnel where it's going to go. And then I place it, I adjust it with my sound. I see a little bit of a pucker here. We're going to just adjust that a little bit. And the first one is in, take it out. And you can see that this is much fuller than it was before. Now we're going to do the same thing over here and on the other side. Okay, the fascia, which is a little thin layer over the muscle up, and I go in with this uterine sound and I dissect out the pocket, and you can see how incredibly thin this guy is. He has no subcutaneous layer, and that's why just putting a bigger implant in him just would not work. But we dissect the pocket, and then we're going to slip in the implant using a retractor to show us the pathway down. I think this one will work best. I'll hold that, and I'll take the implant. Now you can see the shape of his calves when we are done. Definitely not huge calves, but in proportion, well proportioned, very muscular for a male. Next we're going to put on a bulky gauze dressing with the knee slightly flexed, and that'll stay on for about a week to 10 days. And we'll take that off then, and he'll be free to move around. This is how we do calf implants at Orange County Plastic Surgery. Corona Del Mar, Newport Beach, California. Dr. Bunkis signing off.